Hi, everybody. I'm Ed Ternan, Charlie's dad, and we're here today for another episode in our expert interview series. And today it's a real pleasure to have Dr. Elizabeth Zona join us. We came to know at Song for Charlie, Dr. Z, kind of through social media. We connected, and she's been doing great work reaching out to young people and getting the warning message about counterfeit pills and fentanyl out to young people in a relatable way. And she's just a real expert in this area from a couple of different angles. So we're really happy to have Dr. Elizabeth Zona join us today. Hi, Dr. Zona.
Hi, Ed. Thank you so much for having me. It's an honor to be here.
Thank you for doing this. I want to start by, can you tell us your medical background, right? What's your CV look like?
Gladly. Thank you. I am a physician. I'm double boarded. So my two specialties are anesthesiology and addiction medicine. And I hold medical director positions with both of those specialties. So I spend about 70% of my time practicing anesthesiology, as I have now for 12 and a half years. And I just actually started practicing addiction medicine in 2017. So it's sort of more of a calling or passion, if you will. And I became board certified in that specialty in 2019.
Wow. Okay. So you really have some expertise in a couple of directly relevant areas, and that's great. Because I think our audience has a whole lot of questions in general about fentanyl and counterfeit pills and how things are going. And so I wanted to get you on to talk about a lot of that stuff and see if we can maybe clear up some myths and get down to what's really happening. But I wonder, how did you get interested in this space, in this specific space around fake pills and fentanyl?
So it's interesting. I had a friend in high school. We were very close in the middle school, junior high, and high school stage, and in the early college. And she had unfortunately started to use opioid pills recreationally. We'd both been offered them. And honestly, back then, I didn't think it was such a big deal. It was just something that was present at the parties. It was sort of trendy, if you will. But I realized shortly thereafter that a lot of my friends who had experimented with, it was mostly OxyContin at that time, did quickly become addicted. And unfortunately, when I would come home from my breaks from college or from med school, it was seeing just different time periods over time, how addicted my friends became. One close friend in particular did become addicted to heroin, and ultimately she overdosed in 2016. And I promised her twin sister at her bedside in the ICU as she was soon to pass, I promised her twin sister that no matter what, her death would never be in vain, and that we would do something positive to remember Tia, my friend, but also to help other people, because we realized how close we could have come to that same outcome had we made one or a couple different decisions and not even realizing the weight of those decisions. And so that's what started the interest.
So like a lot of us, you have a real personal connection to this and a firsthand knowledge of the fact that it's affecting everybody from every corner of society, right? So what I'd like to do is I'd like to start at the beginning and just do like a fentanyl 101.
Okay.
And I do want to get into this distinction between like pharmaceutical grade fentanyl and illicit fentanyl because they're different. But in general, can you just tell us like what is fentanyl and how is it used in your world as an anesthesiologist, for instance?
Sure. So it's interesting because I have like two relationships with fentanyl, right? From an anesthesiologist standpoint, it's a wonderful medication that could significantly help reduce pain and suffering, really, in the perioperative period, which means the time around surgery. Or even if somebody doesn't need surgery, if they have severe pain, whether it's from a trauma, accident, injury, or from cancer. So those are times where it is quite helpful to patients who legitimately need it. Unfortunately, the recipe, so to speak, has been figured out by people with not so good intentions. And they have realized that anybody who is abusing opioids, addicted to opioids, the nature of addiction is to gain tolerance and seek that next stronger type of high. They call it chasing the dragon. And what ends up happening is that somebody who might be satisfied at first with Vicodin or Percocet eventually may move on to things like OxyContin or harder types of opioids, and ultimately things like heroin. Well, now you enter something like fentanyl, which is actually 50 times as potent as heroin. And what at least 50. And the carfentanil and other analogs are even more potent than that. So what ends up happening is that people do gain this tolerance and get to where, some people, if you've never seen fentanyl before, it could knock you down, you're dead instantly. But some people, I have patients who it's their drug of choice. They use it daily. And the dichotomy of that, people say, how does one person die and one person doesn't? It all boils down to tolerance. Well, our country has a tolerance. A lot of people do. And so where there's demand, there's supply. And unfortunately, it has been a time of massive supply increase recently in the last several years. It has made billions of dollars for drug cartels and other folks with nefarious, if you will, intentions. It has made them a lot of money, but it has also unfortunately lost us a lot of innocent American lives. Where some people may use it recreationally, it's being hidden, so to speak, into things that look like less dangerous products. And unfortunately, as you know all too well, one pill can kill, and that's what we're seeing. So again, I have two very different relationships with fentanyl. When it is used appropriately, it can be a great medication. When it's made rogue, out in the streets, it is very dangerous.
Wow, thanks for that. And it is what we focus on is the deception, right? The part of these counterfeit pills and people getting such a powerful opioid without their knowledge. And that's really what's happening. The one of the roads I'm going down now in my thought process is that the relationship between the seller and the buyer has really changed. And in a weird way, I think the mask has finally come off. You talk about the intentions of the drug traffickers. And we're starting to hear, and maybe you're seeing, stories of people who have been addicted to heroin for years and have learned how to survive and cope. And they're saying, I used to be able to inject heroin in the morning and get through an 8-hour day without getting sick and kind of function in society. And then I could inject again in the evening and get a good night's sleep and hold a job. Now, I can't find heroin. All I can find on the street is fentanyl, and I have to hit it every 2 or 3 hours. I haven't had a good night's sleep in a year. I lost my job. I'm back on the street, which really indicates these drug traffickers are not trying. There's no such thing as customer satisfaction. We talk a lot about quality control, but there's also no such thing as customer satisfaction with this drug traffickers. It strikes me it's all supply and profit driven. So, I mean, I don't know if you have anything to say about that, but that's really what we're seeing in the market. There's that dynamic has completely shifted. These people selling these drugs are not out there to help you have a good weekend. They're out there to make money, right?
Exactly. And primarily my perspective on all of this is from, being a medical doctor. However, the more I've studied on it and researched and sort of engaged my own addiction patients, I've interacted and asked a lot of questions. I've worked with the DEA. I've worked with you guys on presentations, and I have found that exactly what you're saying. It's not about customer satisfaction as much as it is about the profit. Back to your analogy with heroin. Heroin is about $50,000 to $70,000 per kilogram, at least locally where I am, whereas fentanyl is $5,000 to $7,000. So it is that much cheaper, that much more potent. And yes, people are dying. But as the dealer, it's the cost of doing business. Would they feel bad if it were their neighbor or their friend? Perhaps. But I think the mentality is this is happening anyways. People are going to die anyways. What's the harm in me making money in the process?
Right. It just makes it more risky. The whole landscape is just so much more dangerous than it used to be. The whole dynamic has been shifted to the point where we're describing these deaths in different ways, right? It used to be just overdoses, and the people in our world have kind of added the term poisoning to the lexicon, right? Can you kind of talk about why that's important?
Right. Somewhere in working with you and Song for Charlie, I heard the analogy, and I love the analogy. It's perfect. I think we should bring it up. If I drink a bottle of whiskey and I chug the whole thing down and I die of an alcohol overdose, that's an overdose. If I take a shot of whiskey with my friends and they're like, hey, here, do a shot with us, and I shoot it and it's actually cyanide or some other toxin and I drop dead, that's a poisoning. So there's a difference between, somebody maybe doing too much heroin and overdosing on it versus thinking they're doing taking a Xanax pill, a Percocet, one pill that, if it were actually the intended product, would not kill them. And actually dying. So I agree that overdose versus poisoning, there's definitely a difference. And I think that needs to be addressed. People point it out on my TikToks all the time. I'll see people say, you're saying overdose, but it's actually poisoning. And I say, I agree 100% with you. Unfortunately, the medical literature has not changed. I hope to change that because I do think that we need to talk about it, especially with the pediatric population.
Right. Yeah. That's so important, and it's a matter of updating the way we talk about this stuff based on new trends that are happening, and that's going to take a little while. So at Song for Charlie, we talk about poisoning and overdose, or the poisoning and overdose crisis, because we acknowledge that both scenarios still exist, and also technically, overdose is correct. You die because there was too much of a toxin in your system, right? But boy, when it comes to things like prosecutions and law enforcement, it's very important to add the term poisoning as a potential scenario in there, because that's about agency and culpability, right? So there's a lot of people in my world who are very, very passionate about that particular discussion. And it's interesting that sometimes I wonder how much time and energy we should put into kind of setting the record straight, busting myths. And I, for one, think there's some value to doing that because some of these myths and misperceptions that are out there around fentanyl distract us from the real problem. So I'd like to go through a few of those, with your background as an anesthesiologist, and maybe you can help us figure out which of these are true. Like, for instance, the idea that people are overdosing by just touching fentanyl, or in one case, it was a woman who said she touched a dollar bill that had fentanyl on it and had OD symptoms. There was another classic case here in Bakersfield, California, where they claimed a school resource officer overdosed from touching counterfeit pressed pills that might have contained fentanyl. And my understanding from medical toxicologists is that's very unlikely, if not impossible.
Right. Extremely unlikely. Now, I would never call somebody a liar. I don't have all of the information, but what I can say is that if you refer to the American College of Medical Toxicologists position statement, they have that. It's online, it's free access to that. And they do say that just physically handling it, that you would be extremely unlikely to have that. In fact, they have data on there that says you could have exactly how much you could have in your hand and for how long, and that it over time equals about 100 micrograms actually absorbed, and that would be considered a safe therapeutic dose. 100 micrograms I might give you for part of your sedation for a minor procedure. So that would not be considered a toxic dose. That being said, I've also personally spilled fentanyl on myself because I have, drawn it up. And especially as a resident, when you're doing these big cardiac cases and you draw up these big amounts of it, or you had to open it in like a glass vial, and maybe you're like, I've had a cut from the glass vial, and I had it there and I washed my hands. I didn't feel anything. I didn't have any problem. So not only from the American College of Medical Toxicology, but also from my own personal experience, extremely unlikely to just touch and have that be absorbed to the point of toxicity. Now, if you're talking about mucous membranes, if you're talking about a splash, if you're talking about inhalation of a very high concentration over time, that can. But again, it's very unlikely that it would just be down immediately. Now, when you start talking about the carfentanyls and those higher potency analogs, I can't personally speak to that, but the ACMT does have a lot of data that I would refer you to.
Okay, great. Yeah, and like I said, I know we've talked about this before, but it's like we have enough to worry about, and the situation is bad enough without really creating panic. And some of the concern is that, and we'll talk about Narcan, but some of the concern is that we don't want people afraid of rendering first aid if they suspect an opioid overdose, right? That's the big concern.
I would do mouth to mouth myself. If I knew somebody was down, like I personally would still be comfortable doing mouth to mouth.
Right. And
I would put a bamboo bag, but if it was somebody about to die, I would do it.
Right, right. And I think a lot of this happens because of what's the phrase? An abundance of caution, right? And so you hear some people criticize the description of fentanyl as so very, very scary and dangerous. And some of that comes from the fact that first responders and medical professionals and ERs use precautions like gloves and other things like that. And that makes other people think, wow, this stuff is like, radioactive. But the fact is, you all don't know in those scenarios what you're up against, do you? I mean, it could be any substance, you're not sure. And so you're just taking precautions.
Correct. And in the medical environment, you would have your gloves and you would have your mask and your face shield for a trauma or somebody that came in with an overdose. You would have your typical, what we would just call personal protective equipment, as do law enforcement. They know to personal protective equipment. But right, I don't let the fear of it, somehow traveling up my nose, accidentally kind of scare me from taking care of somebody who needs it.
And I think the mouth-to-mouth thing is very, very important because when we get that question in our presentations quite a lot, is it safe to say that if you're giving mouth-to-mouth to someone who's, and this is me trying to answer the question in my layman's terms, that someone has OD'd on an opioid, you're not sure what it is, it could be fentanyl, which is very powerful, and you're wondering if you should give mouth-to-mouth. I think that the fact is, by the time that fentanyl has been absorbed by the victim's body, that's what's causing the overdose. It's doing its work on the victim already. That for you to come in contact with that victim's saliva, the idea that enough fentanyl would be in the victim's saliva or in the mucous membrane that transfers to you and then cause you to get sick is like, that's really not going to happen, right?
It feels like a stretch. And of course, universal precautions are always recommended. And if you have a pocket mask or, something else as some barrier just to protect yourself from any communicable disease, or even if they were vomiting, which sometimes happens during an overdose, all of those things are recommended. But yes, I don't think that any minute amount in their saliva would put the rescuer at risk. Argue, I suppose, in situations where there's, again, the carfentanil, I can't speak to that. I've seen the videos, though, of how fast it puts an elephant down. So I would hope not to encounter it.
Right. That's right.
But I agree, they've typically already ingested the substance. So.
Right. And another thing I'd like to have you describe is, what does an opioid or a fentanyl overdose look like? How can we recognize that if it's happening to someone in our home, for instance?
Very good question. So there's a triad that they speak of to just make it easy to remember. So basically people's pupils being very tiny. So say that they're out and you look and their pupils are just teeny tiny. If they've lost consciousness, so they're no longer responsive to you, and if they're not breathing. So if we're trying to remember just quickly, it's basically the eyes, the mind, and the lungs, right? Those three things. If you see little pupils that are really tiny, they're not breathing and they're not answering you. And on that, typically we see dusky skin. You may see grayish or bluish lips, fingertips. They're not obviously communicating with you or answering you. They could look listless, like their muscles are weak. And sometimes they'll be foaming at the mouth or gurgling sounds. Again, some people have thrown up and maybe you found somebody who's down and there's some vomit there, those sorts of signs. But what you can do too is your knuckles there, if you take them and rub them on the chest here really hard, that is called a sternal rub. And that should hurt and arouse somebody who's just nodding off and really deep and not breathing. And if you do this hard, like you think it's going to hurt them and they still are not responding whatsoever, you're most likely dealing with an overdose, because that is a painful stimulus. And, sometimes it's even, it's been used, say somebody's in the recovery room and you're trying to figure out, okay, they're not waking up. Do we need to reverse something? And you kind of give a little rub. Most times you'll get hey, what are you doing?
Oh, okay.
And, oh, sorry. Okay. You don't need to.
Yeah.
But that can definitely help you to weed out in the beginning when you're trying to figure out what you're looking at.
Wow, that's a good pro tip. Was not aware of that, because what we do talk about in trying to answer that question is it kind of looks like going to sleep, an opioid overdose, and one of the danger signs is they just will not wake up. I mean, if some young person falls asleep on the couch at your home, you need to kind of check on them these days. In the old days, it was like, well, isn't that cute? He fell asleep. Let him sleep it off. Now you might want to shake him. And if you don't get a response, you should start going through that triad and checklist in your mind, right?
Especially in a situation where you think, people have been partying. It makes more than just asleep.
Right. Okay. And then, so to finish up that line of thinking, tell us about naloxone or Narcan, which is everywhere, and people have a lot of questions about it.
Right. So there are three main brands that I know of. The main medication is naloxone, and Narcan would be the brand that everybody thinks of because it's been around, I would say, the longest. Kloxxado is a new brand, Kloxxado with a K and two X's, and Zimmy. I think that's Zimhi. What I do have handy actually is Narcan. And it actually is available without a prescription in most states. You should be able to find it even at your pharmacy. You could call if you have a concern about, I think anybody who has somebody in the home who has a prescription to an opioid, anybody who has a history of substance use in general. And then if you have teens, honestly, I think it's reasonable because these things are out there and the kids don't even know, like we said, that they're taking it sometimes. So it should be available. There was a standing order by the Surgeon General that made it where you don't even need a prescription for it. You could always call the pharmacy before you show up to make sure. Also, nextdistro.org has a harm reduction site, and they have, you can sign up what state you're in and you can get some. So mine right here, if you just peel this very quickly, there are instructions, 1, 2, 3. They make it as simple as possible. And when you open this, there are typically, when I mentioned Kloxxado, it has 8 milligrams of naloxone. The typical Narcan dose is 4 milligrams. But the nice thing about it now is they give you 2 in these boxes. Sorry, they give you. So to try to get up to that 8 milligrams, because the old school heroin overdoses, this might save you. Nowadays, with fentanyl, which, as we've discussed, is a potent synthetic opioid, you might even need more. And if you see on here, there's a little plunger there, and then that's the nose there. The way that would work is basically my thumb would go here, my fingers here, and it would squirt right up somebody's nose. And all the instructions are right here.
And it reverses an opioid overdose.
Correct. So they both act at the mu receptor, which are where narcotics work. They both work there. But what happens is naloxone, being a full blocker, is going to compete at the receptor and it's going to win. So it's going to knock off that fentanyl or heroin, Percocet, or whatever, and it's going to be able to block the receptor so that it can't reattach. Something people don't always know, though, is that Narcan may not last as long as the original drug. So what can happen is somebody can, we call it re-narcotize or re-overdose or re-poison, right? What can happen is that the Narcan can wear off, and then that fentanyl is still around and it can find the receptor again, and then they can go down. So just because you have rescued somebody and they've come back to consciousness does not mean that you should not call 911. It would be bad to go through all of that and come that close to saving a life, and then to find out that the Narcan wore off. You thought they were okay and they didn't wake up the next morning.
Right. That is so important. And I've started to describe this in a little bit different way, because some parents are a little concerned about Narcan being, one of these enabling things, right? Well, harm reduction, we're teaching kids how to use drugs and how to survive, and we really should be teaching them don't do drugs. And it's like, so the way I try to explain to people is, as far as I know, and correct me, doc, if this is not true, but naloxone is the only thing that reverses an opioid overdose. So what I tell families is, if a young person is overdosing in your home and you're doing rescue breathing or CPR and you've called 911, you are buying time for that person so the EMTs can get there and administer naloxone. That's going to be what they do. And then they're going to take them to the hospital and put them on a naloxone drip to make sure that they're okay until the opioid is out of their system. So, and the faster you get the Narcan in, the better. So you ought to have it in your medicine cabinet and not be afraid of this stuff. Okay. And also there's no side effects. So if I make a mistake and it wasn't, my son's friend was just sleeping and I give him the Narcan nasal spray, it's not going to hurt him.
typically no. I would still go through those routine checks to make sure that they're deep, because if you are squirting something in their nose and that wakes them up, then you probably didn't check them well.
Yeah.
But after you go through those checks, it's right. It's not felt to cause any significant side effects if it was used erroneously.
Yeah. Okay. That's great. And, we love what we're doing with you on social media. So you started doing this really creative stuff. And we picked up on your vibe and what you were doing, mostly on TikTok, right? Mm-hmm. And so you're talking to kids and parents both, do you think? And what's your vibe or your philosophy on trying to get the message out to people that way?
So it's interesting. I was a teen once, believe it or not. And I try to think, I won't disclose my age. I want them to listen now. I try to think back to, what would I have listened to if somebody was trying to give me a good message? And back then it was all about, the DARE program and just say no and don't take drugs. As a teenager, I can't say that I didn't experiment with things or, party. I obviously, as I mentioned, happened to make that one decision about those pills right. And I'm very glad about that. But I made a lot of dumb mistakes. I do a lot on my TikTok. I talk about the teenage brain and why it's more likely to make those mistakes, which you can watch on there, or we can talk more about if you like. But the other thing is that I think we need to talk to and with the kids and not just at the kids. So one of the things I love to say is don't dictate, educate. I'm not going to look at a kid and say, don't you ever touch drugs, because think about it. Say that and I'm not equating them to toddlers, but say you had your toddler and they wanted to get in the drawer and you would say, no, whatever you do, don't touch that. What do they want to do? They want to get in that drawer and see what's so interesting that you don't want them to touch it, versus if you talk them through and say, well, this is sharp. This is why I don't want your hand in that drawer. So that kind of just carries on then to the preteen and teen years. They're curious. They're going to have questions, whether we like it or not. And if it's not me or somebody like me who's reaching out and giving these answers, it's going to be that their answers come from the wrong sources. So we were told, don't do drugs, just say no. My approach is just say KNOW. No, let's learn. Let's talk to them. They're curious. Let's tell them why. I mean, their bodies are amazing. And let's tell them how the body works and then talk about how drugs affect each part of the body.
So important. And I think also I would love it if you would go in a little bit to adolescent brain development and kind of neurobiology, because I think that's an important part of how we reimagine the drug talk in America. Again, to just say KNOW, because I think young people, but also I think it's helpful for parents to understand what goes on up here and why is it so important for kids to, because the messaging now is not just say no, don't do drugs. Some of the more nuanced messaging is your brain isn't developed yet, delay, wait until you try stuff, right? So what's behind that?
Right. So I understand the delay recommendation, although I would say that most people then, once you get to 25, when your brain is fully developed, you probably have hopefully developed better coping mechanisms and don't need experiment at that point. But when you think about addiction, you think about two main parts of the brain. And on my TikTok, I have a playlist and it's called Addiction Science. And if somebody wants to learn more, they could look there. I have a lot of diagrams. But basically, if you think of two main areas of the brain, you could think of the reward system, which is basically down by the brain stem. Like it's a very protected area of our brain that has been there evolutionarily speaking for, thousands and thousands, hundreds of thousands.
Our lizard brain, as they call it, right?
That's it. Yes, the lizard brain, a very primitive part of the brain.
Yeah.
So there's that, which is all about our survival as a species and survival as a being. And then you have the prefrontal cortex, which I always kind of tell the kids it's right behind. Like you think about your forehead, it's kind of in that area. You could think of the prefrontal cortex as the CEO of your brain. So the prefrontal cortex is in charge of analyzing and saying, if this, then that. This could happen if I do that. I'm making decisions, I'm processing information. And then if you think about your lizard brain says, that felt good, I'm going to do it again. And so it's a much more simplistic sounding area, but it's actually quite complex. So think about things that make humans survive, whether it's the act of, sexual activity for reproduction, whether it's the act of eating when you're hungry, drinking something when you're thirsty, or those social connections, snuggling with your new baby, or that big hug that you get from somebody that you love. Those are all rewarding things that we do, and that's for a purpose. The reason that they're so rewarding is because they can help in our survival, whether it's procreating and survival of our species, or whether it's because we're eating when we're hungry so we survive. All of those are sort of communicated in our brain in a language that we don't really understand, right? Because it's neurotransmitters creating pathways and creating signals that then form memories and then form connections that lead to encouraging certain behaviors. So what happens is, if I'm hungry and I go and I eat something delicious, I have nice, rewarding neurotransmitters releasing dopamine saying that was good, I should do that again. And I'll store memories about where to find food, how to eat food, social connections with food, memories, cues, what it smells like, what it felt like in my mouth, all those things you don't even realize that you're forming those connections. Now enter things like cocaine, methamphetamine, heroin, fentanyl. The amount of dopamine released is unbelievably higher than that delicious meal or that wonderful hug. So what happens is it's such a strong signal that it actually overpowers and speaks over those other rewarding behaviors. So you're no longer thinking, man, I'm really hungry, I want that steak, that would be so enjoyable. Your brain has experienced fentanyl. Nothing else is on its map right now. It is like fentanyl, fentanyl, fentanyl. It is so addictive. And again, with all of these drugs of abuse, it's going to create those passageways, those transmitters and those circuits really in your memory that connect your survival to those behaviors. And that's what's so scary. You read in the newspaper about a mom overdosing with her baby in the car, and people say, that terrible mother, what a terrible mother. I get it. That's obviously putting the child at danger, but think about how hijacked her brain has to be for her to prioritize that substance so desperately when someone that, and someone that she loves, someone that she cares for, is put at risk. So it is such a powerful force. And it happens so quickly. The human brain can become addicted so quickly, especially with the potency of these drugs that we're talking about. But the hardest thing, for me, the hardest thing about this level of addiction is that you can no longer appreciate those simple joys until you recover and heal, which is absolutely true, absolutely possible. But when somebody is in fulminant addiction, they don't feel the reward from that hug of somebody that they love the same that they would before. They don't get enjoyment from that meal or from that sweet treat like they would prior. It really does rewire the brain. So back to adolescence, the prefrontal cortex, that CEO, that area of the brain that's going to say if this, then that, is not developed until age 25. So they're not there yet, but they do have a lot of drive and a lot of activity in that reward pathway. Why? Well, from an evolutionary standpoint, when someone got to 13, 14, 15, 16, they weren't upstairs playing Roblox. They were out hunting and gathering and helping the family build a home and get food to eat and support the family structure. And so we've sort of maybe changed a lot, but our brains haven't when you come area of the brain. And kids have, as with the teen, there's a lot of emotional drive. There's a lot of, I don't want to say drama, but there's a lot of things that we say, why does that matter? And it's so important to them. So that all comes from that area of the brain, the amygdala and the emotions. And so that area is in hyperactive mode, but the prefrontal cortex is just not fully developed yet. So you tip the scales. They're much more likely to be brave, to not be afraid, to take risks, but they're less likely to be able to say, this risk is okay, that risk isn't. And so to them, a beer and hiding from their parents may not seem all that much different than, taking a pill, which, as we know now, Xanax may not have killed them 10 years ago, but today it's certainly likely that it's not real Xanax and it's fentanyl and it can kill.
That topic right there, that understanding helps on so many levels. One is the it's very important not to stigmatize people who are suffering from addiction because their brain really is hijacked, right? And our goal for that population should be to get them into recovery so they can kind of enjoy life again, for sure. But it is also explains a lot about what's going on, and to young people that I'm very interested in the brain body distinction, where you say you may be feeling really good up here when you take this substance, but down here it's doing real damage to your body. And with synthetics and powerful drugs like fentanyl, what's happening in your body is it's shutting down very quickly, not gradually, not over years, but like right now. And I think that would open a lot of eyes. That's the kind of information that curious young people are thirsty for. And so if we can get a little more nuanced and elevate the conversation with them a little bit more, I think that's really valuable. And I love that. I love that you're doing that. It's so important. But it brings me to a question that we get from parents a lot, which is, what can I do if I think my kid, and we get this question from young people a lot too, what can I do if my son or my friend or my cousin, I suspect that they are addicted to opioids or taking these pills? I'm starting to see some signs. What should I do personally? And then what resources might be out there? And it's kind of tough, especially for people under 18, isn't it? Treatment and recovery resources?
It can be. There is help out there. I always direct people to 1-800-662-HELP. And that is the CMSA hotline, and they can get you in, references to your local area, because I think especially social media, it's best to do a national number so that people in every area can access. If you suspect that somebody that you love is using, if you're finding paraphernalia, if you're finding signs, chances are it's happening. Be ready for the denial, because that's our first natural response, right? It's my boyfriend's, it's my friend's, somebody else left this here. If it's in your home, it's your problem. And a lot of times our first instinct, again, is to say it's not, and it's not happening. But if you're seeing signs, try not to fall into the denial pattern, because I see that a lot with parents where they'll say, well, I saw this or I saw that. If there's stamp bags and syringes in your kid's drawer, they're most likely already addicted to heroin. Because think about it, if this were something that they were recreationally doing with friends, it wouldn't be to the point that they're bringing it home and stuffing it in their drawer. So part of it is just the accepting that you have the problem. And then, I hate to say prepare for the lie, but it's a survival instinct once you're at that point of addiction. And they feel that once they get caught, that they're going to get separated from the thing that's making them survive. A warped way of thinking, I get that, but it definitely, you see it that way. And a lot of times at this point, people know they need help, but they don't want to reach out for help because they, again, are afraid of failure. And they realize how far gone they are at this point when things are starting to show up in the house. But to your point, addiction can happen so quickly. If it's there, act on it. Do not wait. Talk to them now. Try to get help now, because you do want them there tomorrow.
Right. Well, Dr. Zona, I thank you so much for coming on and talking to us today. You're doing incredible things, and our work together at Song for Charlie just inspires me every day. I do not spend any time. I spend very little time on TikTok. But yeah, you're a rock star on TikTok, and you guys are, yeah. and you and Krista from our TikTok account are doing things together, and stitching, I guess it's called, or whatever. But anyway, it's really important, and your voice is really important. We just did a research study that indicates when we talk to young people who they would trust to ask questions and to get information about drug use and this new stuff that's going on in the drug landscape. And the number one answer was healthcare professionals. So yes. And so you personally and your profession, the more you all can do to elevate the conversation and update everything based on what's going on today, and figure out, like you're doing, how to talk to young people, critically important. We can't thank you enough for the work you're doing.
Thank you so much. And the last bit of information to share again with the adolescents is, that it's not just a matter of whether you're finding the fentanyl in the operating room or on the streets. They are different. Something that's made in a field with, dirt, and it's not clean, it's not sterile, and it's inconsistent. That's the biggest problem, is the inconsistent dosing. When I give 50 mics of fentanyl, it's 50 mics of fentanyl. It might be 49.999. It might be 50.00001. But when you get a pill, that you don't know has fentanyl in it, there could be none in 99% of that pill. And that one little area of the pill can have enough fentanyl to kill you and 3 of your friends. You just don't know what you're getting. And so that's the big message, is really that it's not pharmaceutical grade, it's not safe, and it shouldn't be at these, parties or at schools. To me, it's a weapon of mass destruction. It really is. And I think that if we approached it like that, then we could hopefully get it away from our kids.
Yeah. And it's interesting that you say mics. You're giving people micrograms,
Correct.
right?
Mm-hmm.
And over time, you're administering micrograms over a certain period of time.
Yes.
And in these tablets, and again, you can do a reality check with me. You can have, say, 120 milligrams total in a tablet. And the active ingredient, let's say in a pharmaceutical pill like Tylenol or something like that, the active ingredient is somewhat less than that, because some of it is like binder powder and other stuff, right? So the DEA says a lethal dose of fentanyl in powder form potentially is about 2 milligrams of fentanyl. Milligrams, which compared to a microgram, how much more is that?
So there are
1,000?
Yeah, 1,000 milligrams, 1,000 micrograms in a milligram.
So you're taking, 1,000x more potentially, if you put that pill in your mouth, of fentanyl than would be, and it's going in one decision. Once it goes in there, decision made, no going back. And whatever was in that pill is now starting to be processed by your liver and absorbed in your bloodstream, compared to a medical setting where it's being delivered in an IV drip in micrograms per hour or something, right?
Yeah.
Wow. That's mind-blowing.
So when you think about it, I'm trying to think the most I've ever given of fentanyl in a surgery was like, it ended up being like 1,000 micrograms, and it was like a 16-hour case, open heart valve aneurysm. I mean, these are whopping doses. Yeah.
And you're using that as part of an anesthesia cocktail, so to speak, to put this. Now, I've had open heart surgery. Mm-hmm. So they put you out. If you have open heart surgery, you are knocked out, right? Okay. And so in that environment, you're still administering this in micrograms per hour. And these tablets contain a couple of milligrams that you put in right away.
We would be giving typically boluses of, 100 micrograms at a time, or a couple hundred micrograms if it's a big open heart, like bigger surgery. Like even in the operating room with somebody full under anesthesia, if you do give, 100 micrograms, you can see the heart rate drop a little, the blood pressure drop a little. You can see changes, as we would call hemodynamic changes, from just those small microgram doses as well. You would never, ever bolus anything in the milligram version, ever.
Wow. Again, it's such a striking contrast, and yet it's something that people don't understand. We constantly show them these few little grains of powder, and what we haven't started comparing it to is what the medical dose would look like in a hospital is way less than that, right?
Correct.
Way less than that.
Correct.
Wow, amazing. Well, thank you, Dr. Z. This has been great. We've learned a lot. We really appreciate everything you're doing for our kids and families and trying to address this new problem. And we really enjoy working with you, and we hope to do more stuff in the future.
Thank you, Ed, and thank you to your family and to your whole organization. You're doing wonderful things. I share everything that you post every chance that I get, and I know you're saving lives. I absolutely know you are, so thank you.
Well, it's an honor to be in this fight with you. Thanks, Dr. Z.
My pleasure.